Hello, everyone, and thank you for joining me today as I share the Axxess Home Care solution. I'm Melissa Baxley, and today I'll be showcasing specific tools developed to assist you in caring for clients insured under the Department of Labor, or DOL. At Axxess, our home care solution is crafted by home care experts for home care professionals such as yourself. This solution is highly regarded by clients for its versatility, designed to cater to a wide array of organizations. It stands as our most customizable offering, providing support across the spectrum of care, from pediatrics to geriatrics. Today, we will focus on exploring how Axxess aids you in caring for clients covered by this unique subset, the Department of Labor. Let's get started. Once an individual has obtained their white card and the doctor has ordered specific services, it's time to get to work in Axxess Home Care. A single chart unifies all programs and services in one location. This improves patient outcomes by offering transparency into all the services being provided. The Axxess system supports the pre-authorization process, which includes the pre-admission interview and the entry of pending authorizations, even when a client is in pending status. Now that we've touched on pending status, let's move to a client in active status. Notice how we effortlessly switch between pending and active statuses. Here we'll shift focus to those caregivers performing tasks, many of whom, as we know, are family caregivers. We have simplified the scheduling process by categorizing them as family providers, denoted by an F within the staff preferences dropdown. This ensures that they can easily be located when scheduling for that client. Yet another way Axxess facilitates user friendliness. Moving on to documentation for these caregivers, we have streamlined the process to accurately capture visit details through our mobile application. This not only enhances client outcomes and caregiver experience, but also ensures compliance. Our implementation team will provide assistance to ensure a smooth setup in the app. Before we bill for the completed task, let's explore how billing is set for the Department of Labor within Axxess Home Care. From the View tab, you're able to view all of your lists, which includes payment sources. For this demonstration, I'm using DOL Utah as an example payer, but you're able to enter different bill rates for different states. Here we have the Payer Requires Documentation function that drives the Department of Labor documentation attachment. We'll also indicate that the claims will be submitted electronically through the Axxess Clearinghouse directly to CNSI. These items ensure that required documentation attaches to the claim for electronic DOL submission. This tab also drives authorization setup. So if you check authorizations are required, then if you schedule over your authorization, the system will alert you. You can also create claims based on authorizations for a mix of services. If your client needs both an aide and a nurse, for example, you have the ability to split those if they have different auth numbers. There's no manual manipulation needed. The system will do that for you. In the next tab here, based on your payer type, you can add specific locators if required. Down here at the bottom, this is where that rate and code and all that good stuff drives from. The bill rates are established per task. I've set up rates for both an LPN task and a skilled nurse visit task. Billing will occur based on service unit type. You see here how these two tasks have been structured differently. I'm going to use the skilled nurse visit for my example task. After you enter the procedure code and rate, you choose the service type based on the payer. In this case, I've chosen to use a G code, that 15-minute code, and a rate of $40 per service unit type of 15 minutes. You're also given the option to set time limits. So after 1 hour, the system magically converts those 4 15-minute units into one billable hourly unit. There is no manual manipulation needed. Another way we save you time and money. Now that bill rates are established, we're going to view the client's authorization list in their chart. Accessing this area enables you to monitor and bundle all of those authorizations, both pending and active, through the Authorization Manager. This streamlines operations by allowing full visibility into Department of Labor approvals. Once visits are completed and it's time to bill, all of the billing takes place under the Billing tab within the solution. Let's navigate to Outstanding Claims and filter that payment source to our DOL Utah example. Once the claim is completed, everything that we just did in the Payment Sources screen triggers the automatic documentation attachment. A checkbox will appear to the left once the claim has been verified. You'll simply check that box and submit electronically with that documentation attached. The claim will flow through the Axxess Clearinghouse and submit electronically to CNSI through our exclusive connection. This saves you time and gets you paid faster. Remember, this is just one portion of what our home care solution can do for your business. We invite you to take a deeper look at Axxess Home Care today.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on Software Advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.